Experts are warning it's likely to become a pandemic. There are at least 11 confirmed cases in the U.S. Fears the number of cases in China could be far higher than reported, 17,000 now, and more than 30 countries are restricting travel from China.
The striking figures, the U.S. now leading the world in deaths, with the coronavirus claiming more than 20,000 American lives.
20,000 plus Americans dead. The numbers are staggering and especially frightening because they're climbing so rapidly.
U.S. officials are scheduling another evacuation flight to get more Americans out of China.
Even with efforts across the country to try to slow the spread, the U.S. death toll has doubled in the past week with no signs of slowing down.
But over in Europe, the virus grip is growing tighter. Italy now has the highest death toll for COVID-19, and more than 74,000 people have tested positive.
Hi, my name is Miracle. I currently work as a store manager in the retail industry. COVID-19 has impacted my family in a way that I think will be a little more appreciative of the small things. With having a grandmother that's 86 years old, it's a little scary because you just don't want your loved ones to come into contact with that. You want to be as careful as possible. You think about the smallest things that you come in contact with and you ask yourself, did I contact it at all? And you just want to make sure you don't pass that along to your loved ones.
Hello, my name is Matthew Bocanegra. I'm an EMT. In terms of my family, my mom is actually a kindergarten teacher and she's stayed home and has been operating her classwork as best as she can online. But for me, I think I would say that she's doing okay, and that the whole situation that's going on right now, some jobs are more safe than others, and her job and my job are definitely safe, and I am grateful for that.
Hi, so the coronavirus has infected me and my family by just making us aware of our exposure. My family's from Washington, so I'm constantly checking in on if they've gotten their food before everything's shut down, if they are following the quarantines and making sure they're safe. Here on base, I'm in the Army. It has made us have to move around and do some telework, and we are now stuck to a 30-mile radius of base as well, just for safety.
Hello, my name is Dill the Nomad. I am an artist, musician. That's first and foremost, but secondary occupation, I guess, what I have to do for money. I work retail, so that's at Old Navy. How has COVID-19 impacted you and your family? Makes me a little bit more suspicious, second guessing going to visit family members. I live by myself. I live with a roommate, but I live away from my blood relatives. So it's got me a little hesitant on wanting to visit them. Not because I think they're sick, but because I feel like I'm pretty immune to it. Maybe not immune, but I feel like I have a good chance of surviving, so I don't want any way possible of me possibly getting my mom sick, getting my aunt sick, getting my grandma sick.
My name is Uche O'Hare. I'm currently a student at California State University, Sacramento. I will be graduating in December with my degree in child development and a minor in counseling. And the way COVID-19 has kind of affected me and my family is by that the schools have been closed down all across California. So therefore everything is done remotely. And I have recently lost my job due to COVID-19. I work on campus, increasing enrollment for African American students. So since there is no work right now that you can do in person, I don't have a job right now. But otherwise, my family is full of essential workers. So they are kind of on the front lines of COVID-19, still having to go out and assist people every single day. So we're kind of, not say at risk, but they're still taking their very safety precautions by sanitizing their clothes and sanitizing their hands as much as possible and wearing their mask.
How has COVID impacted myself and my family? Well, luckily, my husband and myself are currently still essential workers. So finances are great, luckily. but it has affected my kids and myself not being able to see my mom and my dad, and my kids not being able to see their grandparents, their cousins, their friends. My daughter is currently going through tough times because she's 7. She's not able to finish her year of first grade. She suffers from dyslexia, so being home, it's not the same help and care that she was getting from her teachers at school, with reading and math and all of that. So not only am I doing full shift here, I'm having to homeschool full time as well at home when I get home. So it's been tough on us, definitely something different, but we're taking it as positive and well as we possibly can. But we definitely miss our family members and our friends, and we can't wait till this is done.
My name is Kyle Alston, and I work at Food Lion. COVID-19 has affected my family by putting my little brother out of school, and my mom's a teacher, so she's out of work. However, my dad and I are both deemed essential workers, so we're still going to work.
Hi, my name is Chris Purcell. I am currently a student at the Pennsylvania State University. I'm a second semester senior who has unfortunately lost that semester due to the outbreak of the COVID-19 pandemic. In my life, the pandemic has so far affected me. I've been isolated inside of my house for a month and a half to try and avoid any contact with the outside that would potentially expose me to the virus. It has unfortunately canceled out my senior year, so I've lost my ability to experience that, but that's kind of on a lesser scale comparatively to what others have gone through. The rest of my family as well has also been on isolation. My oldest brother, Noel Purcell, is a housing lawyer, so he was actually exposed to the virus for a short time, kept himself in quarantine and kept himself in isolation, and has managed to beat whatever virus, whatever sickness he had, so we're very thankful for that. The rest of my family has been safe, but we've all been affected in the ways that most American families have, where we don't have the ability to experience life on a normal day-to-day basis, and our regular work and jobs and schooling have all been suspended.
Hello, my name is Fatu So, and I am a current graduate student at Johns Hopkins University School of Advanced International Studies. And it's interesting to see how COVID-19 has impacted me and my family because, for one, I was living in Italy when everything was transpiring. So my first year I completed it in Bologna, Italy. So I had literally been in Italy since last August, and I had to leave abruptly 2 Mondays ago. So this upcoming Monday will make it 3 weeks since I've been back. And so that was, it took a pretty hard toll on me because I had to leave immediately. And so I moved out of my apartment. I only took 2 luggages back with me to the States. But that whole situation was very interesting because me and my roommate had to quickly uproot. So we had to find a flight that was still leaving out of Italy to come to America. And so we found a flight through, I believe, Delta, but it was through Alitalia. So we had to take a train to go to Rome. And then from Rome, take a train to go from the train station to the airport. And then we stayed at the airport overnight and then got on the flight to go from Rome to JFK, and then I had to fly from JFK to Detroit. So that's been, it took a pretty hard toll on me physically and mentally. I still have classes that are online and they're on Italy's time. So yeah, I still have to get up like really early in the morning for classes. I think I'm just now getting adjusted to it now. But it's been pretty difficult. In terms of my family, I have a couple family members, who work in hospitals, a couple family members and friends. And so just seeing how the virus has impacted them has been kind of stressful. I just try to make sure I check on them as much as I can, like every week and everything.
My name is Olivia Johnston. I'm an admissions counselor and recruiter for Wiley College. How has COVID-19 impacted me and my family? I would say I'm pretty lucky. I travel a lot for my job, shaking hands with a lot of students in a lot of different events. So when I came back in March and they started shutting the school down and banning recruitment travel, within a week I was back. I just considered myself very, very lucky to have not caught anything with all the traveling that I was doing beforehand. As far as my family, we are okay. We are working remotely from home, except my mom. She does work in the hospital. So she is on the front lines of things. It's very worrisome. It is. But I just have to keep the faith just like the rest of our family does, and just take care of ourselves the way that they are telling us to. Staying home, washing your hands, things like that.
My name is Maya Giovanni, and I am a storyteller working in the film and television industry. I do live away from home in LA, and so this pandemic has definitely affected just communication with my family. We talk a lot more often, and it's affected them in a sense of their work because I come from a line of entrepreneurs, and so my mother and my uncle, who are both beauty professionals, their clientele and just their entire day-to-day work has been completely affected by this. So not only coming from a space of survival mode, but a creative mindset to maintain relationships and virtually serve their customers has been a task during this time. But gratefully, my family saves, and they're super strong, and so they are okay. Luckily, we are all right at this very moment. We are okay. I too am completely thankful for just support and stability. I'm living with family friends, and so that has been super helpful because I'm not sure if I would be able to stay here if I didn't have their love and their support. I think that everyone at this current moment, and also just to mention my grandmother, she's in her 70s, and so this has affected how she's moving every day. She's very active, so for her to, really stand still is not something that she's used to, and staying in the house and, not going out or putting on a mask and gloves and just following precautions. It's a change, it's a shift.
Hi, my name is Memnard Grayson. I work for the Federal Bureau of Prisons, and COVID-19 has affected me. I can't see my daughters because I work in the heart of the lion's den. And I try to, after work and things like that, like now I'm off for 4 days, so I try to quarantine myself for like 2 days before I see someone that I love, which right now my girlfriend's birthday is coming up. So I'm quarantining myself to make sure I'm okay and nothing's wrong with me. And then, I can see her.
My name is Roanne Mendiola, and I am a pre-nursing student at Cal State San Bernardino. COVID-19 has impacted my family by forcing us to be conscientious of ourselves and our surroundings. My family tends to have members who are in the medical field. My mom's a nurse, my uncle's also a nurse, and I'm a future nurse. But I'm worried about my uncle because he works in a COVID-19 unit at his veterans hospital, so me and the rest of my family are all worried about him.
Hello, my name is Samantha Robinson. I'm a fourth-year, 5-year MBA major from the Bay Area in California. I believe that COVID-19 hasn't affected my family too negatively, only because both of my parents at home are both essential workers. My dad works at San Quentin State Prison, and my stepmom, Star, she works with the health industry.
So there are ways coronavirus has affected me and my family. My mother works in healthcare, and she's had meeting after meeting, of course, with her hospital that she works with. She works more on the corporate side of things, with healthcare and quality, on how to prevent and how they're going to handle patients and things of that nature. So she's been working very hard, and that's how Corona has kind of affected my family.
Hello, my name is Milan Robinson. I am the Associate Director at the Democratic National Committee's Department of Leadership. My family has been impacted by COVID-19 in a couple of ways. Mainly, my mom, she works at the CDC, and she was deployed to help the arrivals flights back in March in Chicago's O'Hare Airport, screening their passengers for COVID-19 and other flu-like symptoms. She's since been tested for COVID-19 and tested negative, so that's a good thing. Other things like my siblings being laid off from their part-time jobs and their semesters being cut short or drastically altered has really shaken up and impacted my family's day-to-day.
Hi, my name is Nick Zablon. COVID-19 has affected me in a number of ways. Most notably, I've been working from home. I'm obviously needing to quarantine. Probably the worst way it affected me was I'm a political science student, and I got invited to attend something called the Fraternal Government Relations Committee, and they have these Capitol Hill hearings every year, and they select like 100 fraternity and sorority members from across the country to go to this conference and go to Congress and talk to different politicians and basically lobby for issues relating to fraternities and sororities. It was a really cool opportunity. My national organization, Delta Sigma Phi, they were gonna pay for all of it, flight, hotel, kind of a once-in-a-lifetime opportunity to go to Congress and go meet all these politicians, and that got canceled. So that was very disappointing. My summer camp, which I did for the first time last year, and it was an amazing 2 months. I've been looking forward to going again all year, so that it's looking right now like that might not happen, just based on how slowly everything is opening back up. As for my family, my parents are thankfully county workers for San Bernardino County, and they do have good unions that are making sure they're still getting paid.
My name is Thomas Curry, and I am a student, a graduating senior at Hampton University. I major in aviation management with a concentration in airport administration. So the public's response to it, as you can see in stores, that there is a shortage or not even any toilet paper or Lysol products. Honestly, to me, that's definitely egregious. Even when stores put out that limit 1 per customer sign, usually in every store, it is pretty lamentable for there to not be any toilet paper, sometimes even paper towels, or any Lysol products like hand sanitizer or disinfectant spray. And I definitely think that, if everybody had followed that, just take 1 rule, or maybe even 2, that there would still be enough for everybody. Because I know for myself, I'm definitely running short, so.
Okay, so my feelings towards how the public is handling COVID. I wish people would take this more serious. And by me saying that, wearing masks, stop wearing the gloves. I mean, people are just contaminating things even more with the gloves and not changing them if they're not properly using them correctly. The overbuying of food, it's not necessary. We're not going on a food shortage. The toilet paper, I still don't get that, but there's that. Just the older people, elderly people are limited to food because they can't go out if they don't have, family members shopping for them, or, the people that have low immune systems. So I'm praying for everyone and for everyone to stay safe, because at this moment it's just very scary for everyone.
I'm Keenan Baskerville. I'm a full-time sales lead at the Express Factory outlets in Norfolk, Virginia. I think that the government's response and the overall public response to the virus wasn't taken seriously as it should have. I feel as though a lot of college students and people who are in their mid-20s, late teens, saw the virus as a joke, something that would blow over really fast, and it didn't. I feel as though our government could have taken better precautions or better measurements in general to just make sure that this pandemic didn't go on as long as it is now?
The public's response to the pandemic, I feel like we should have taken it a lot more serious a lot sooner. I get that this is, spring break, and people wanted to travel, but that just made the situation worse when people did not follow the orders to, stay inside and do not be on large groupings. I think that set us back quite a bit because we weren't all practicing the same behaviors in that aspect.
I believe that this country's response to COVID-19 has been pretty lacking. And I believe that other countries' responses, for example, South Korea, has been very well in that they provide universal health care and that they've been able to limit the amount of COVID-19 cases. However, I also appreciate my privacy, so that's not something that I would be willing to give up, in order to track people who have had COVID or tracking people who leave their house or whatnot. I definitely would not like to see that occur in the U.S.
The public is the public. They're going to do what they got to do to survive out here in this world. Some going to listen and some's not going to listen. That's how the world is.
I think on that same level, the public isn't doing enough on its own. I think enough of us are inside and are trying to stay isolated and practice social distancing and do the things that we've been constantly told to do by medical professionals. But I think we still see too many people going out, going to parks, constantly walking neighborhoods and whatnot. I understand the need to want to leave the house and want to not feel cooped up, but I think it's more important that we as a society together find a way to just suspend our activities for a bit and find a way for us to just sit in our homes.
It's a change, it's a shift in your lifestyle. Even it's been a month, but that is a long time to be concerned. That's a long time to even just be in your home or just be dealing with something that everyone is being affected by. So that just goes for me to say that I think that everyone is responding the best that they can. And I hope that people are recognizing the significance and importance of this, and the seriousness of this.
Mixed responses. There's a lot of both sides. Me personally, don't think it's that serious in terms of deadliness, but a lot of people dying. They're reporting a lot of deaths, so I don't want to take any severity away from that, but I don't know. That's all I'm going to say. I don't think I should judge it. I think a lot of people are taking it very serious. I definitely am taking it serious. I'm quarantining.
As someone who's directly involved in the medical field at this point in time, it's definitely interesting watching the overall shift from the way we would normally do things in the field to how we're adapting to this overall pandemic. I actually had my very first COVID-19 positive patient today that we were transporting from a dialysis center to be checked out for dialysis-related concerns involving his blood pressure. So although he wasn't going in for treatment of COVID-19, the way that we brought him into the hospital is totally different than how we normally would. When I called in to the hospital and gave them notification that they were receiving somebody that was COVID-19 positive, we were instructed to wait outside as the nurses got the appropriate PPE, that means personal protective equipment, ready to go to approach the patient. So upon bringing him in, we had our temperatures checked. Everything was in order in terms of gowns, goggles, gloves, hairnets, everything they needed to make sure that the spread was contained. So we brought him to a part of the emergency department that was specialized for COVID suspected and COVID-19 positive patients. It was filled with zippers and barriers, and overall the entire other half of the hospital emergency department was totally different and designed for these patients. So yeah, that's pretty much how I would say the climate is looking like right now in terms of bringing patients into the ER.
Some of the positive things I've noticed, especially in media, I have seen nurses and doctors and people that work in the hospital taking the time out of their day to inform us about symptoms, what we can do to help, what can we do to prevent COVID-19 after they've worked their full days taking care of COVID patients, taking care of their regular patients. I just thought that was something that needed to be appreciated, and I totally appreciate for them doing that and trying to at least spread knowledge so people know exactly what is going on and how to help get rid of this epidemic. Also, I've seen celebrities sort of like promote staying at home and do TikToks and just to social distance yourselves. So I think that's another positive note of how the public has responded, that we're at least trying to spread the word through certain medias where people can actually understand, and through medias that people watch on a daily basis, such as Twitter and Instagram and things like that.
In terms of the public's response to COVID-19, I was very surprised at everything that was happening, because while I was in Italy, things seemed more calm in my opinion. I feel like the Italian government acted as quickly as they could and tried to take control of the situation as fast as they could in a timely manner. And so at first, a couple of rules that they implemented included keeping restaurants, bars open from 6 a.m. to 6 p.m. But then that quickly switched as they kept seeing the amount of deaths rise. And so then it just became only go out for essential needs. People were still, jogging and everything. But I think that the response from Italy compared to America has been very different. I think Italy, America, a lot of countries that have high amounts of cases, everybody's response has been different. Seeing what President Trump has put in place, I'm not as sure as to how the situation will go through, because now he stopped funding from the World Health Organization. He basically removed the entire response team who was working with COVID-19 besides Dr. Fauci. And so, yeah, it's been kind of stressful being back home just to see how things are happening. I'm also in Detroit. That's one of the cities that has the highest, Michigan in general has one of the highest amounts of cases of the coronavirus. So it's been pretty frightful, and being, as a Black woman, being in this situation is not exciting, because you see the toll that it really takes, and that it has taken on our city, on our people, on our friends. And so that's what's really been the biggest impact for me, is just seeing friends and loved ones and family members who've passed away, who have passed away from the virus. So that's been very sad.
I feel like at first, and maybe even a little bit now, a lot of people in the public aren't taking everything serious with regards to social distancing and not having gatherings above 10 people. However, I feel like we were in the right with regard to shutting everything down and only leaving the essential businesses open.
I feel like people were very lax and did not take this pandemic seriously, especially back in January and February. It really was mid-March that people were like, oh, this is going to impact me and my day-to-day schedule. Maybe I should start watching the news and pay a little attention. But given the lack of leadership in this country, I'm not surprised people weren't taking this seriously, especially when the president was saying that this was a Democratic hoax and that no one was actually sick and that there were no cases in the US, even though there had been cases in the US as far back as January. I still think people are not taking it as seriously as they should be. I also feel bad for all of the events that are being canceled, like people's weddings and like people having to give birth alone and not surrounded by their family members. I think the public's response is varied, and we're all a little cynical and going a little house crazy right now.
I'm really disappointed in the way America handled the pandemic. I've seen people show apathy and overreactions, because there's people who walk around in groups without masks, and I've also seen people buy necessities in bulk and then resell them at inflated prices, and I think that's just really ridiculous. because in this universal time of need, we should all be helping each other out, or at least trying to alleviate the pain and struggle of the medical workers who are risking their lives to save ours.
I think that kind of goes when seeing what other countries have done. I mean, you look at China and you look at South Korea, two countries that had the virus, for one first and the other at the exact same time that the United States' first case came out, and they're both as close to anyone as taking society back to its normal basis. I mean, Chinese citizens are starting to go back to work. South Korea is starting to reopen a number of its entertainment areas. I think just the very clear differences in how different countries have responded to it so far and the successfulness of them should be absolutely utilized and absolutely understood by the people in our country and by the elected officials in our country.
I think China is the best example of a response to the pandemic. When it first started, they immediately started quarantine. They built 10 hospitals. Granted, they lied about the numbers, so that gives them a little discredit. But I think they showed what you should do. You should shut down everything. You should really focus on keeping the sickness localized, keeping it from spreading as best you can. And within 3-4 months, they had it, or at least they reported that they have it resolved. Us, I think we're stupid and lazy, and we saw the warning signs, and instead of thinking, oh, everything comes from China, maybe we should, take some precautions, we waited until it was here, and now people are panicking.
Other countries, I haven't really heard too much, but in Nigeria, there hasn't been too many efforts to stop COVID-19, only due to the fact that not a lot of people are listening, and it's because of the government, how the government is being ran in Nigeria. They're not taking it too seriously, other than not letting people come in and out of the country, but they're not giving any resources to help the citizens of Nigeria.
And as far as other countries is, like I said, other countries, I think we have to protect ourselves over here as a country and make sure that nothing gets in. I believe the border should have been cut off a long time ago, but that's how the world goes, It's really not a lot about common sense. It's a lot about politics. The way politics goes, the way the world goes. Because we all got common sense, we just don't use them,
The country's response to it, I think it was delayed as well. I don't think anyone thought it would be as serious as it was, considering that, Italy shut down. That should have told us, hey, as the indicator that, we need to get ahead of it. Instead, we reacted about a month late.
And I feel as though, comparatively speaking, other countries' responses to the virus, was a lot more on hand and handled better. Like, for instance, in China, from the jump, they just shut everything down and made sure that no one went out. Or like in Italy or France, they just have everyone basically on lockdown to make sure that people aren't spreading it as rapidly, whereas here it's just like we're just adding 30 days to a tentative schedule, I guess, where we're meant to stay indoors or just social distance, and everyone is just still going out, having parties, having large gatherings, things of that nature.
And I feel as though other countries' responses to the pandemic have been, I just kind of have mixed feelings. I think that European countries are trying to take the necessary steps that they need to take. I think some African countries are as well. It is disheartening to see the use of force that some of the police officers have been using on their citizens, in a couple articles that I've read, and just explaining that using that type of force is not going to stimulate trust from the public in response to the police, which will probably make people tend to stay out even more and ignore the rules. I think another thing in terms of this situation that I've really been looking at hard is just seeing the economic disparities that Black people tend to have in general across the diaspora and in the world, and that in turn leads into also health disparities. So knowing also that, you know, hospitals, certain doctors already treat us as if we're fine when we know that we're dealing with certain implications. And to also know that a lot of Black people have to work in positions where they have to sustain their families. Like they have to be in positions in terms of like being essential workers, in terms of like when I think of African countries, a lot of people work in informal sectors and they have to interact with people in order to survive. So my overall opinion has been mixed since I was living in a country where it was a wide outbreak of it, and now I came back to my country where we have the highest amount of cases. But one thing I will say is that we just have to wait to see how everything unfolds. Everybody still needs to take the necessary precautions that they have to take, and honestly, for me, I just have to trust in God because that's all we really can do at this moment.
I have not been able to pay attention too much to other countries. However, I've seen both sides of the spectrum. I've seen countries, I believe it's in Europe and Italy specifically, where people can literally not leave their house. Like they cannot leave their front doorstep because of how severe and how many cases there are in that country. People not being able to leave Italy, go out of Italy, see other people and things like that because it is that serious. And at first I thought it was just really dramatic, like, dang, we can't, they can't even go out to the grocery store and just, put on some gloves. And no, they've had a ridiculous amount of cases there. So action needs to be taken. So I don't think it's too dramatic anymore with the amount of cases they've had, the amount of deaths and things like that. And then I've also seen the total opposite in certain places. People not really caring. Parks aren't closed in certain countries, or public places aren't banned or locked or fenced up like they are here. So I've just seen both sides of the spectrum country-wise as well.
And then for other countries, I think they're doing a lot better than America right now in terms of their response to it, because what everybody's pretty much been told to do is, quarantine themselves in where they are so that they don't spread it, like if they're sick or if they have it. However, here in America, it's kind of hard to know who has it because not everybody's able to get that testing done. So other countries, if they're able to get that testing done, they quarantine the personnel that's infected. And recently there's been a lot less cases in other countries, but America is the leading country for COVID-19.
I don't like the way that China, instead of being transparent about the virus, they were trying to silence the doctor who discovered it and was illegally going out of his way to try and warn the medical community about this new disease he discovered. He should be celebrated as a hero because he unfortunately passed away because of the virus. But China was definitely silencing him. They arrested him. I believe he died in custody. I may be wrong on that. But it's just a really bad situation, the way they handled it. I think it's interesting to see how some countries are really on top of it and proactive, like Germany, France, England. I think they've done a very good job of containing it. Spain too. I think Korea's done an amazing job in terms of testing. Italy is weird because I have an aunt who lives in Europe and she was explaining to me that she feels Italy actually did do a good job of preparing. So that may have been a cultural thing where you had young people going out and partying. You didn't have people listening and doing as they were told with the stay at home. So it's definitely interesting to see how some countries are doing well, others aren't. The Netherlands is a very unique situation where they had a small enough population and they have a fantastic healthcare system. So the Netherlands response was, do nothing. We're going to continue as normal. Our healthcare system is going to be able to treat people. We're not going to be running out of resources. In fact, we have a surplus. We're going to be like, if the worst came to worst, we will still be able to treat everyone.
I feel like some other countries have taken extreme measures. I can't remember the name of the country, but I seen they were beating people that were coming out or that were disobeying the stay-at-home orders. I feel like there's somewhere in the middle that should be met between the radical countries and how the U.S. is handling it.
I think other countries' responses to this virus were a lot stronger and a lot swifter than the United States. That's for a couple of reasons, starting with the lack of leadership we have at the top of the federal government, but also just the American sense of individualism versus collectivism as a social norm. We're very much used to operating on a do what's best for us and work it out for ourselves because we don't have anyone to depend on. That kind of mindset is pretty much prevalent throughout most Western and capitalistic societies. So more group-oriented and collectivist mindsets countries were able to mobilize and get a lot of things done a lot quicker that we're just now getting to the tip of the iceberg here in the United States.
America isn't handling the pandemic crisis as well as other countries have. Korea and Canada, I know that they're both offering testing to the public, and it's a lot easier to access than here in America. And that's really shameful because illness doesn't discriminate. I mean, it kind of does, depending on on how it's segregated and the population density, but it's an illness. Everyone's susceptible to illness. Some are more likely to survive it, but still. I just feel like maybe if America had universal health care like other countries did, it would have alleviated the demands that this pandemic is asking for.
In terms of what I think about COVID-19 and how the world is viewing it right now, I just think that it's really important that we stick to researching and challenging our beliefs and challenging our political views, because this situation is, in my opinion, a lot more complex than the way people are describing it as. The situation is not something I would believe the first thing I read about on social media about. It's just really important to make sure that the appropriate information is spread about this entire thing.
Man, it does disappoint me that different countries are responding a lot differently. We experience so much as a community, and when I say community, I mean Black people. But I've seen some very heartbreaking articles in parts of China where Black people are being kicked out of their residence because they're more likely to contract the virus than any other race, but this is a global issue. So things like that tear me up, and they don't make me feel good. Even with being in the situation that I am, to know that someone somewhere else is struggling just puts me in a place. And so right now, all I can do is pray for peace around the world, and hope that people look at the bigger issue, look at the task at hand, which is maintaining so that we can come up out of this, and to be obedient so that we can come up out of this stronger. So my hope is that people remain as uplifted as they can be, and do what they know how until further notice. My heart goes out to everyone really experiencing tough times, but I hope that some light can appear soon. Really do.